Hello everyone. My name is Epidemiological and welcome to EB Speaks. And today we're talking about promoting the left shift in your health and well-being. My special guest today is lead general practitioner GP at the Allerton and Westfield Medical Centers and clinical director, Chapelton Primary Care Network, Leeds, United Kingdom, Dr. Abiye Hector Goma. Dr. Goma, can you tell us a little bit about yourself?
Right, thank you so much. I feel privileged and highly honored to be your guest. Thank you so much. Yes, I live in Leeds. I'm originally from a wonderful place called Ogoloma in Okrika in Rivers State, Niger Delta, Nigeria. I've been living in Leeds for 23 or 24 years. So I'm a Yorkshire lad, I'm a general practitioner. I'm really passionate about people looking after themselves because prevention has always been and will always be cheaper, more effective than cure. So
wow.
That's what I'll say.
Wow, that is so straight to the point. But anyways, I want to talk about you for a little bit because I spy on you.
I spy with my little eyes.
Yes. So, Dr. Goma, because I know that you're involved in so many community projects. You're like so much involved in community development projects at home and abroad. And you're deeply involved in the Wakrike Development Coalition, the Wakrike Radio.
Yes.
The Unity Concert. It's quite a mouthful, and you champion the growth of the Wakrike language through the Wakrike or coin classes. You do online now because of the COVID, the COVID situation. And what you do is push the agenda. Amaibigose. And guys, please excuse my French. What it means is for the good of the land.
Sure.
So you do quite a few voluntary and community-based initiatives, I would say, and your love for your community is tenacious and almost infectious. And in my interactions with you, I want to say something about you now, and it speaks volumes about the quality of person that you are. Even in just the little things that I sent to you, like I sent you one of my promos, and you just picked the spelling. You're like, is it this or that? I'm like, okay. And so whenever I send something, right, I have to be like very particular about the grammar, the spelling, the tenses, because you pick. And that shows me the degree or the excellence that you operate. Is it in or on now? Because I have to mind my grammar. But anyway, what pushes you to do all of the things that you do?
I'll be honest with you, I've asked myself that question and I've come to a conclusion that it's grace. That's all I can say. I think that, just to digress, I've been frustrated in working with people. Sometimes I expect too much from people. And then one day it was like a revelation, as it were, to me that for every situation, God gives people grace. And so for the Amaibigose thing, maybe I have 110% grace. But somebody else maybe has just 10% grace. And I should be thankful for whatever people can bring in, because maybe that's all the grace they have. But honestly, it's a passion I have, trying to make a difference in the life of one person at a time. I think that's my purpose in life. I think when all said and done, that's what drives me. That's what gives me pleasure. It makes me satisfied that I can make a difference in one person's life. So it's grace more than anything else.
I'm very proud of you, my brother.
Thank you.
I wish we have more of you. And I know we have more of you, like that.
Yeah, many more.
Yeah. And I was reading through your resume. I told you I spy on you. And you were described as a driver of practice improvement processes. What does that mean?
Well, patients get frustrated all the time. I mean, the biggest frustration of patients in general practice, they cannot have access. You know, they go on the phones, and I'm a patient somewhere. So sometimes I call my own GP and I'm on the phone for 5-10 minutes. I get very upset, you know, but sometimes you phone a company like one of the banking corporations, and some of them, I won't mention any name, you phone is as if they're waiting for your call. As soon as you dial, they pick it up. And I wonder if they can do that. Why do I have to spend 5-10 minutes on the phone? Why should my patient spend 5-10 minutes on the phone? So every time I'm asking myself, what can we do to reduce patients' frustrations? What can we do to improve patient experience? Now, a lot of times, many of those calls, I consider them irrelevant calls. Somebody has a headache on their way to shop, they had a headache, and then they phone the practice. And you get to call them, so you have a headache. Okay, when did it start? It says 2 hours ago. So what have we done about it? Nothing. Have you taken paracetamol? No, I haven't. And I'm wondering, you have a headache which is 2 hours old. The basic thing you should do for yourself is to take 2 tablets of paracetamol. If the headache doesn't get better and then you call me, you've done what you can do for yourself. And that's why I keep on saying that, how can we improve practice? Anything we do, the base of the pyramid lies with the patients. If every patient does what he or she can do for themselves, it will reduce the number of people that need to call their GPs. And that's why I'm really passionate about self-care. Let people know what to do for themselves. What we call red flag symptoms. If you have what is called a thunderclap headache, it's a severe headache like a thunderclap at the back of your neck, that is a medical emergency. When you have that kind of headache, you know straight away, this is not the everyday headache. I need to speak to my doctors right away. But when you have what we call chronic daily headache or tension headache, you should know the difference. And when you have that headache, you know, I've overworked myself, or let me just rest a bit, let me take paracetamol and all that. If it's not working, then I call my doctors for help. So that's why I'm always looking, how can we make things better? How can we make better things? Sounds like thermocol advert, but that's the kind of thing that always drives me. I want my patients to be happier patients. I want them to be happy with the service I'm giving them. At the same time, I want my patients to look after themselves and do what they need to do first at home. And then when they get in touch with me, I want to be sure that I'm there for them.
We're going to get to that. I'm going to ask you a few more questions about that, but we're going to get there. And now, let's see. And as a matter of fact, you have touched on it, and I'm going to go there now. So you are, again, you said it, but I mean, an advocate of patients taking responsibility for their health. And you have mentioned, as it were, that the patients should, you know, be able to know the difference between a thunderclap, headache, and you know, just the minor tension headache. So, in your opinion, then there should be a cooperation between the patients and the doctors, or rather the patients, because you mentioned self-care as well. So the patients then should be what?
They need to be expert patients.
Okay.
They need to know, I mean, that's what is called patient activation measure, if I could say that when patients have the knowledge, the skills, and the confidence, they know when to self-care.
Okay.
And they know when to seek for help. So what drives me is that I want more patients to call me when they need to call me, not when they want to call me. So they call me because they've done the self-care and it's not working. And then they need to go to the next level, but not when they've not even tried self-care, when they should try self-care.
Doctor, when we isn't self-care, self-medication sometimes, and like in Nigeria, for example, I'm just giving you two extremes. Somebody has a headache and everything is paracetamol, agbo, piridiri, or something. And the person has a headache or the person has fever, and the person goes to, well, they have a box full of medication and they take it. And assuming they have you know more difficult situations that presents itself as a mere headache, and they keep taking paracetamol, but it's a deadly situation, then what do we do?
Well, that's why I said having the knowledge. If a patient has a symptom, which is, for example, a 50-year-old man has chest pain, I don't expect him to call his GP. He or she, he knows that this is 999.
Okay.
So for the patient to know when this symptom is a 999 call, which symptom is a GP call, and which symptom is a self-care call. So actually, health is a continuum.
Okay.
From being healthy and well and not even requiring any medication whatsoever, to having common ailments like headache, or you ate something, you had diarrhea for 24 hours, to needing to speak to the community pharmacist, to needing to call the GP for an appointment. So the whole idea is that I want my patients to be well knowledgeable, to know the difference between having paracetamol in my first aid box and taking it, when to go to the shops and get some antacid for maybe a bit of indigestion, when to seek advice from the pharmacist, and when to call my GP. So I would like every patient to have that knowledge of what is ideal for which symptom. It won't happen overnight, but it's for people. I mean, that's, for example, the self-care forum is an online thing. There's NHS choices. If you go to your practice website, like my practice, and many practices are up and down the country have things like called e-consult. You can type your symptom and we can ask a few questions. And when people begin to do such things, you reduce the pressure on your doctors, because there are those basic symptoms that you can practice self-care efficiently. And that's why they say if you take paracetamol for, say, 2-3 days, if it's not getting better, call your doctors. Most self-medication advice is like that. If you've done this for a few days, it's not getting better, get in touch with your doctors. So do that initial bit, and not, straight away try to get an appointment and then you slack off your doctors.
Okay, so we're talking about reducing the pressure on the doctors. But doctor, I want to ask a question, okay? Because now I know that you're talking, I want you to think now in the Nigerian brain and in the London brain. Okay, because when you tell me, for example, that you could go to the local pharmacy or the community pharmacy and you do, it's like in Nigeria, for example, we have what did I say, with the apparent infrastructural disservice or deficit we're currently facing at home. How can a patient successfully win in this responsibility of self-care?
Well, let's look at the issues of the reality that 4 things affect our health. 1, the genes we are born with, which you can't do much about. 2, our lifestyle and behaviors. 3, the quality of health services that we have at our disposal. And 4, the environment that we live in. So when you talk about Nigeria, you have the patent medicine seller, you have the pharmacist, you have everybody who works in hospitals is a kind of doctor, from the auxiliary to the nurse to the pharmacist to the doctor. Everybody's a kind of doctor. Of course, we have family doctors. So if I have a headache, somebody in my family can say, in that Nibua, or in those days they say, Mutemia, sorry, have you got to take injection there and all that. So the point is that it depends on the environment where you live in. But whatever environment you live in, I think people need to educate themselves and begin to know what are the simple things to use for simple symptoms. And if it's not working, what to do next.
Okay. Now you talked about the something. You talked about the website.
E-consult.
E-consult. Is it
Yes.
the people pay or is free?
I mean, for the practices that have it, like in Leeds, the clinical commissioning group, the bosses of health have paid for e-consult for all the practices in Leeds. So if you go to your practice website, and you can do that. So if you want a fitness note, you can just request a fitness. If you have an admin problem, you can request an admin problem. If you have a symptom, it will now take you through, ask you all the questions. And by the time you finish answering the questions, it will send a message to your doctors, or to tell you this is a serious one, stop what you're doing, call an ambulance, or it will say go to the pharmacies and get a minor ailment from the pharmacy. And that's a kind of support system which is available to all 800,000 people in Leeds.
What about in Nigeria?
Well, in Nigeria, we don't have that level of sophistication. That's why I said it depends on what people have. So the person who is a managing director of a company in Nigeria may have a private practice setting where whatever problems they have, they can just call and book an appointment. Another person can be living at Bundu Waterside or at Marine Base in Port Harcourt. That person may have to go to the nearest available patent medicine dealer to try and solve their problems. So it all depends on what people have. There are self-medication and delay in accessing health is more rampant because people don't have the funds to go and get treated. While here, primary care is free at the point of need.
Okay, it's quite it's green, isn't it?
Hmm.
I'll just now, before I ask you the next question, let me see if we have any contributions or anyone on. Okay, so I have I have people saying hello to us, and some people on YouTube also saying hi, and someone saying good day, Dr. Abiye, and Obele saying hello, EB. Guys, this is a question. I mean, let me just say this. At the end of, we're going to have this in two parts. So after we've had the conversation with Dr. Goma, you can also call in and ask questions. So now the other thing I want, and then guys, if you have any questions, please feel free to write your questions and your comments in the comment section or the text box if you are on Zoom. Now, now we go to the meat of the matter. The Centers for Disease Control, CDC, says the top 10 causes of death in Nigeria are lower respiratory infections, neonatal disorders, is it neonatal and neonatal, HIV/AIDS, malaria, diarrheal disease, tuberculosis, meningitis, ischemic heart disease, stroke, and cirrhosis. And one second, but then the WHO also has this to say, because I just felt that there was a little bit of you're gonna get it when I say the world's biggest killer is ischemic heart disease, responsible for 16% of the world's total deaths. Since 2000, the largest increase in deaths has been for this disease, rising by more than 2 million to 8.9 million deaths in 2019. Stroke and chronic obstructive pulmonary disease are the second and third leading causes of death, responsible for approximately 11% and 6% of the total deaths, respectively. And low respiratory infections remained the world's most deadly communicable disease, ranked as the leading cause of death. So the WHO puts the respiratory as number 4, whereas we have it as number 1.
Mm. Right.
Is it because of the income, whatever?
Well, there's something that is called epidemiological transition.
Okay.
Every part of the world starts with infectious diseases.
Okay.
As countries become more affluent and more developed, infectious diseases begin to reduce. So things like improved sanitation, improved nutrition, immunization, all those things minimize infectious diseases. And then you now have a transition from infectious diseases, which are the communicable diseases, to the non-communicable diseases. And that's why in our part of the world, you have more of the infectious diseases that you mentioned, while in our part of the world here, you have more of the non-communicable diseases. And that's why, coming back to what health is all about, we have wellness as a concept. You have physical wellness, spiritual, economic, social, cultural, psychosocial well-being. So when places are better developed, then you have ischemic heart disease because you now have problems of lifestyle, diet, physical activity or its lack thereof, stress, and all that. While back home, we have poor sanitation, immunization uptake is poor, people don't have work, we have very massive income gap and all that. And that's why things like malaria, tuberculosis, HIV, diarrheal diseases are still rampant. And that's why one of the things which is true, that 80% of health is social factors, only 20% is health factors with the way we know it. About 20 years ago, I had the opportunity to speak in the House of Commons here, and I talked about how the heart health, the concept of a house. And I want us to just look at health from that point of view. At the base, at the foundation of the house, that part of the house that we cannot see is where we have the broad determinants of health. So things like housing, where people live, things like work, things like the quality of schools that your children are sent to, those are the building blocks. That's the foundation of health. Now, people who live in poorer parts of every part of the world are more likely to fall ill, while those who live in the more affluent parts of the community are less likely. So that's the foundation. Then you come to the ground floor of the building. That is where our lifestyle and behaviors come in. You know, people who are poorer are more likely to smoke. Wealthier people smoke less. People who are wealthy are more likely to go to gyms and jog every day. Poorer people are less likely to do exercise, apart from those who do manual work. So things like smoking, the junk food, you know, at the beginning of transition, the wealthier people were the ones that are eating the McDonald's and shawarmas, but now they don't eat those things again. It's the poorer people that are eating the junk food. So that's the house, should I say, the ground floor of the house, the lifestyle, alcohol, smoking, food, exercise. Then you go to the first floor of the house. That's where you now have cholesterol is rising, blood pressure is rising, sugar levels are rising. And then you go to the second floor of the house, the high levels of sugar have now led to diabetes. Blood pressure has now, so diabetes, heart disease now coming, and then you now go to the roof of the house. Diabetes, heart disease now causes heart attack, you know. And that's the way I want us to remember health, that the foundation of health is not diabetes, is not hypertension. The foundation of health is the quality of homes we live in. Look at Port Harcourt, where people are just living and breathing soot on a daily basis. Compare the air in Port Harcourt to the air in Leeds, where I live. Why would I have a lung disease? Why won't my brothers and sisters die from lung disease in Port Harcourt in the years to come? And that's why I really want to focus on the social determinants of health, the foundation of the building. Work, housing, money in the pocket is what determines the health of people.
Wow. Before we continue, I'd just like to say a huge welcome to my to people who have taken the time to come join us. So we have Mary. Mary, thank you. We have Uncle Datoru Paul Worika. Welcome, sir. We have Yibo Coco. We have my daughter Gogo. We have my husband. We have Victoria Ajayi. Victoria, thank you so much for joining us.
Victoria Ajayi is the president of Nigerian Community Leads.
Oh my goodness. Hi. Thank you for coming. We have Victoria Gomba. Victoria Gomba, thank you so much for joining us as well. And guys, if you have any questions or contributions, please feel free to be part of the conversation. Now, I want to say this, and the statistics is quite scary. I mean, what you've said to me is absolutely mind-boggling, especially when you look at diseases as a social, you know, for what you're saying to me is that what makes us sick is 80% environment and social factors and 20% health. Is that what it is?
Definitely. Definitely.
Okay. So
let me just digress before you continue.
Okay,
when I was working in pediatrics as a medical student, doing my posting in University of Port Harcourt Teaching Hospital, I remember thinking once that the children were just always coming in with diarrheal diseases. And I remember thinking then that the Commissioner for Water Resources in Port Harcourt has more to contribute to managing diarrheal diseases than all the pediatricians in the hospital. Because if there's pipe-borne water in Bundu Waterside, in Marine Bays, in all those waterfronts, if there's clean water, that will just wipe away diarrheal disease from Port Harcourt. And that's the key, that the health of people lies primarily in the non-health sector. What do? We spend all the emphasis on oral rehydration salts. All we are doing is to try to dress the problem instead of getting to the root of the problem.
So you're saying that if, for example, the government provides the basic infrastructures like water, housing, drainage, and all those kind of things, then the health conditions would improve drastically.
Well, definitely. That's why infant mortality is next to nothing in places like Norway, Sweden, and all that, while in sub-Saharan Africa, the numbers are shocking. Is because of development reduces mortality of women and children.
Development reduces mortality of women and children. Wow. So the statistics are very frightening. And I know there's a lot of Africa people here, so I'm going to say some things in Africa because I know you're going to understand when I say it. But the scariest part of what you've just said to me is that typically in our culture, right, when someone dies, you know, dies suddenly, you know, via one of these conditions, right, we would say, yeah, yo, and please excuse my French because I like speaking Okrika, but I know my Okrika brothers will understand what I'm saying. He says, "Mayefe koruma, mayefe kawari koruma, mi ofumaye." Burufika waro ruba mi ofumaye. And guys, what it means is, Doctor, your Krikese language teacher, please, what does that mean?
Well, literally.
Translate, because I have one more to say.
Burufika Warioru means the jujus of the house have not eaten yam. You know, when somebody has not eaten, the person gets upset and then they now...
So we have failed to appease the gods.
Yes.
And
so
then when someone... and then when someone suffers a stroke, they would say,
yes,
the first I heard I wanted to collapse. And really, simply means that someone who suffered a stroke, it means that he was slapped by a ghost. And to be honest, the guy can't say I wasn't slapped because his face is turned to this side and he's like this, and he can't say no, it was a thunder. What's the headache again? A thunderclap headache. He can't say, oh no, my head was burning, because the person, so his mouth is bent this way, his hands are this way, he's completely, besides himself. So he can't even defend himself. And in those days when they say this is how ghosts talk, so the person can't even say anything. What happened? So those are the things that happens. So we entrench some of the deadly diseases and circumstances to spirituality or to things that we don't understand. So now we know, because the global statistics say that those things do happen because of our environmental factors and health and lifestyle. And again, because in Nigeria now, there's a lot of we're getting affluent, and a lot of middle class people don't even, we think sometimes that going to Mr. Biggs or eating snacks is affluent or enjoying life. So a lot of the people are really, really suffering from those kind of diseases. So now the next question I'm going to ask is, so how can we manage or prevent some of these conditions better? You've talked about the doctors and infrastructural development would help the communicative diseases and all of that. But I'm talking about now the pulmonary heart conditions and stroke, because they're prevalent.
Right. In terms of what to do, I'd like to look at it at 4 levels. One is the individual and family level. The next one is the community level. The third one is the governmental level. And then the fourth one is the societal level. In terms of individuals and family, sadly, my elder brother died from diabetes and its complications a few years ago.
Yeah.
So that tells me that I am at risk of diabetes. My nephews and nieces are at risk of diabetes. So there are things that I can do to improve my health. If I don't do them, it won't be surprising if along the line I become diabetic. The good book says, my people perish for lack of knowledge. So the first thing is that at family level, if my family decides to improve the kind of foods we eat, not just for me, but for the whole family, if the whole family makes lifestyle changes, it means that my risk will reduce, my children's risk will also reduce, the whole family risk will reduce. So at the individual and family level, we need to make changes. And honestly, name the condition. The changes you make, the lifestyle changes are about the same for every condition under the sun. So the changes we make for diabetes are the same ones we make for hypertension, for heart disease. They're all the same lifestyle changes. So the first thing is that at the individual and family level, we need to make lifestyle changes we'll talk about. Then the next one is at the community level. A lot of the practices we have, I remember late Ransom Kuti, Olukoya Ransom Kuti, the former Minister of Health of blessed memory, said, we have traditional practices, some of which are harmful to health, but some of those practices are actually beneficial to health. So things like breastfeeding, they're good for health. Things like the entire village bringing up a child, they're good for bringing up well-grounded people for tomorrow. So there are those practices which are good that the community needs to imbibe. Things like teaching the language. Our languages are going extinct. Learning your language and your children being able to speak their language fluently gives a level of confidence, a level of self-esteem. When that child speaks the language at home with confidence, when they become teenagers and they have all their adolescent crises, they probably will be in a better position to resist behavioral suggestions by their friends because they have a better level of self-confidence. In our thought, as our people will say, they have native intelligence. So at the community level, we need to imbibe good behaviors and encourage it. Your your educational achievement at age 18 is said to be the most important determining factor for your health in your 50s and beyond. If you live in a community where some people are indigent and there is no communal support for children of such people, if they have poor education, they're going to have ill health tomorrow. So being my brother's keeper, supporting one another, making sure that if I didn't go to school, my child goes to school, my grandchild goes to school, we all working together as a community to improve the level of education of our children is something that will improve their health down the road. Then at governmental level, honestly, it is just sad that we live in a world where kleptomania, kleptocracy has been there all the while. When you look at how much money is stolen in Nigeria, for example, if that money is converted to primary schools, primary health centers, good roads, water, and all of that, the health of Nigeria will be transformed. Look at a place like Kerala in India, where they have a literacy rate of almost 98 or 99 or more percent. The health of people in Kerala is so different from the health of people in the rest of India. And that's why government needs to invest in those basic things: education, primary health care, water, sanitation. If those things are invested in, I think we're going to have much healthier people. And then finally, at societal level, philanthropists, organizations like Wicked Development Coalition, we need to come together. It's a together everyone achieves more. I can do my little bit, but if I add my bit to Auntie Victoria's, to Brother Toro's, to Sonia Nebi's, to Victoria Gomba, if we all add our little bits together, we will achieve more. And I'm really passionate about intersectoral collaboration, people in the public, private, community, and voluntary sectors coming together to make a difference in the lives of the ordinary people of our communities.
Dr. Goma, what you're saying to me is very deep, because now you're looking at something you've just said that resonates with me and that rings a bell. You're saying to me, and I'm sure that a lot of my viewers have picked that up, that once the health of the nation is good, then practically every strata of society would be good. And then you're looking at health, and for you view the health of a nation as not just being the physical health in terms of the body, you're looking at it in terms of infrastructural, social, community, family.
Honestly, I say this here in a lot of my health networks, that doctors and nurses represent failed health most of the time. What we try to do is to repair people's health when it has failed. Things like health checks, things like immunization, which promote health, fine. But when you come to me to check your blood pressure and manage your diabetes, I'm trying to repair your health, which has failed. The local council or the ministries back home, the governor back home, those ministries that provide jobs, that provide excellent school, that provides decent places, the air we breathe is fine, the water is not polluted. If you go to Ekerekana in Okrika, the refinery has messed up the place. If all those things are not happening, that is where health lives. Health resides where people live, where they work, where they play, where they pray, and where they love. That's where health is. Coming to the doctors to come and treat headache. Probably I passed my neighbor generator that was working all night. It's what has given you headache in the morning. And then when I come and give you paracetamol, I'm not curing the headache. But if there's 24-hour light supply in your area and you don't have to hear any noise, that headache will disappear. And that's why I believe strongly that we should put more emphasis on the broad determinants of health. That's where health resides, not in hospitals and health centers.
Gosh, thank you very much, Dr. Goma. I want to read a contribution to this, and somebody is asking a question, and that's a question I also want to ask you now. So how do we make the left shift to promote a better health?
Right, okay. Haven't talked about your genes that you can't control, the health services which can't control, that you need benevolent leaders to be able to provide proper health services. The environment requires everybody working together. The one thing which is within your control, which is within my control, is our lifestyle and our behaviors. The unfortunate thing is that our lifestyle and our behavior is heavily impacted by the environmental factors. And that's why it's always important to mention this, that the educated person is more likely to make a healthier choice than the person who is looking for food to eat. If you don't have food to eat, whatever you are given, you will eat. But if you have money to buy food, you can now choose the healthier options. But having said that, there are a few things that we all can do, and that's where I would like to look at the concept of wellness. There are people who have now gone into what is called lifestyle medicine. And what lifestyle medicine is talking about is what you or what me, I can do as an individual to improve my health. The first one I want to talk about is diet. Before we go into left shift, diet is so important. Of course, we all know that statement that you are what you eat, something like that.
Yeah.
Diet is so important. A lot of, before now, we ate out of ignorance. So a man will eat 4 eggs, he'll have chicken and all that. You put massive pounded yam. As a wife, you want to show your husband you love him. You just put in massive plate of food. That's how we were. That's how we started. But now we should be wiser. If you put a penny between your toes, and if you stand and you can't see that penny, then you know that you have truncal obesity. If you try and grab the flesh at the side of your tummy and you can grab something, it means you're overweight. So diet is really important. And in terms of diet, the first thing I want to quickly mention is that we have the main kinds of food. And good diet means cutting down on sugar, cutting down on salt, cutting down on fat, and increasing your intake of vegetables, as well as having enough fruits. And that's the diet. The American Diabetic Association has a simple suggestion about how much, what good is like. That take your plate, the plate you used to eat, divide it into 2. Half of that plate should be non-starchy vegetables. Most of us don't eat vegetables at all. But if you really want to improve your health, improve your wellness, let half of your plate be non-starchy vegetables. The other half, divided into 2. Let 1/4 of your plate be starchy foods, whether it's rice, eba, whatever. Let your eba be 1/4 of the plate, and let the other quarter be protein. Now, if you have that picture and try to make your plate of food like that, what's going to happen is that the calories in your food will reduce. When you reduce the calories in your food, there'll be less sugar entering your system. The more sugar that enters your system, the more sugar gets deposited. And when sugar gets deposited, your weight increases. And being overweight or obese is almost a risk factor for name any chronic condition, obesity or being overweight. So that's the first one, that we should all move away from that concept of, yeah, I don't suffer, make I chop. That I don't suffer, make I chop is probably going to give us problems. So diet is the first one. So the quality of the food as well as the portion. A lot of us as Nigerian men, Rivers men, African men, we are guilty of big portions of food. So calorie density comes from big portions of food. So we all need to try our best to try and restrict how much we eat, and try and think about the plate concept. So that's the first thing I'd like to talk about, diet. The next one is physical activity. I mean, I can see my nephew Ibo here. He's done circuit dance. I'm sure even circuit dance, people are dancing, doing exercise. Many of us, and I'm inclusive, yesterday I was in my office from 7 a.m. till 9 p.m. And in those, how many hours? 14 hours. I'm sure I was seated for about 13 of those 14 hours. That can reduce your life by 5 years over time. Sedentary lifestyle will shorten our lives. So we need to move at work. Try, like now I'm sitting down. If I can stand up while walking, try as much as possible to see whether you can walk standing instead of sitting down all the time. So if you have to be on the phone, try and stand and make the phone call instead of sitting and making a phone call. Spend more time standing at work. And at home, if you can spend more time standing, that will be of benefit. Then things like walking, jogging, dancing, skipping, swimming, anything you can do that will make you breathe faster, make your heart beat faster, make you sweat. Whatever you can do that can do those three things, that is exercise. It doesn't matter what it is. Make your heart beat faster, make you breathe faster, make you sweat. That's exercise. And then the third one I would like to mention is sleep. The good book says he gives his beloved sleep. And many of us, and I'm guilty of that, spend endless hours not sleeping. And one of my friends told me today that we're going to pay the price someday. So I don't know what is good, but at least 6 to 8 hours for an adult per day is what we should have. But this idea of staying up all night, sleeping 1 or 2 hours has massive knock-on effects on our well-being. So I'll start with those three: diet, physical activity, and trying to get enough sleep on a daily basis. Well, if I have to go on, then a few more would be, of course, avoidance of risky substances. I mean, risky substances in terms of alcohol, smoking, whatever smoke that is. If you have to drink alcohol, if you don't drink, better. But if you must drink, then, I mean, try to minimize it and have at least 2 days in the week when you don't drink at all. And another thing is stress management. Many of us are under various forms of stress. And a friend of mine said yesterday that you need to have, if this is your stress container, you need to have some holes where you learn to distress. Last night we had what we call Kingsmen, a Nigerian men in lives in their 40s to 60s. We meet up once a month on Zoom and we solve the problems of the world over 4 or 5 hours. And that is fantastic social capital, because by the time we finish that meeting, everybody feels very good. So every one of us must have social capital where you interact with friends, you can laugh and you'll find yourself crying from laughter. And that's the kind of thing that helps to improve our wellness. So whatever Nigeria throws at you, find a way to laugh at Nigeria's problems. Don't carry it on your head. And all that kind of thing would improve our life and well-being. You're on mute. You're on mute.
Ivy, unmute yourself.
Oh, okay. Sorry. So from what age should you begin to eat the way your guest is describing? Because teenagers eat strong and healthy. Yeah.
Well, the thing is that the healthy eating should be a lifelong thing, but we all know that children don't want to eat vegetables at all. It doesn't, that's what it's been like. They will not eat vegetable, but it's about having the knowledge. And then parents talk about trying to creatively do the vegetable thing, but I won't bother so much as long as the principle is there. If they see you eating the vegetables, even if they don't eat the vegetables along the line, they will eat it. So, but I'll worry more by the time, I mean, they say from age 25 for the African and African Caribbean and South Asian, we're likely to become hypertensive from age 25. So I would say by age 25, we need to begin to take our diet more seriously.
Okay. I would just, someone says here in YouTube, it says, I am enjoying this discussion, especially the okrika spice you guys are throwing in. And what do you expect? My brother is the Dr. Goma is the Wakrika language teacher now, so you have to expect that's, you have to expect that. Someone says at 25, life just they start to. But anyways, doctor.
Yes.
Now there's also a rise in all sorts of cancers. The kind of sicknesses that we've never heard in our lives before, we're hearing it. and it's scary. You go to the hospital, you see children with rare forms of cancer that you thought were just in the books, you know. And so my next question then would be, what are the simple symptoms in life that you should never ignore?
Right. Okay. The first symptom is blood. Apart from unexpected blood, we know that it's normal for a woman in her reproductive years to have her periods every month or whenever. That's normal. Apart from that, every blood is an abnormal symptom. So think about blood anywhere. So either bleeding from the nose, bleeding from the mouth, bleeding from passing urine, bleeding from back passage, any blood at all. So for the woman who has stopped her period, so having bleeding from the vagina when a woman is not expecting it is not something to ignore. So outside of the period, bleeding after intercourse is not something to ignore outside of the period. Of course, a week, a few days after the period and all that, that's understandable. But when a woman is not expecting any blood, any bleeding, it's a red flag symptom. If a woman has become menopausal, menopause is defined as no period for 12 months, then you're menopausal. So anytime before then is perimenopause, around the menopause. But once it's more than 12 months after you've had your last period, any bleeding after that, you need to have a check. So blood, if you brush your teeth, you find blood, don't ignore it. Of course, people have nosebleed, but if you have, for example, bleeding from nose only on one side, you know, a child or a young person may have been having bleeding once a while, but if, for example, you're 60 years old and they've not picked your nose, there's blood coming out from one side of your nose, you can't ignore it, have it checked. So any bleeding at all is not to be ignored. Back passage, urine, coughing, again, coughing blood, vomiting blood, brushing your teeth blood cannot be ignored. So that's the first one. Anything blood cannot be ignored. Sadly, there are some symptoms which are common symptoms, but then common symptoms, let's say rule of thumb, I would say for an adult who is over 40 or in the UK is over 50, if you've had symptoms for more than 3 weeks continuously, please check these symptoms out. One is cough. That's why if you have a viral cough, we expect it to last for between 1 and 3 weeks. So any cough that has lasted for less than 3 weeks is unlikely to be a big deal. But if you've had cough for more than 3 weeks, please check it out. So 3 weeks is something that I want us all to remember. It's not unusual to have diarrhea today and then after maybe have constipation next week, and it's not a big deal. But if you've had diarrhea which has lasted for more than 3 weeks, please check it out. If you've been constipated for more than 3 weeks, please check it out. So any symptom that has lasted for more than 3 weeks, please check it out. Back pain is the commonest musculoskeletal problem. 95% of back pain will go away within 6 weeks. 95% of back pain. But having said that, for some people, back pain may be the only symptom of ovarian cancer. And you can just ignore it. So that's the sad thing that, look at something like what is indigestion, bloating. Any woman who has bloating symptom, who is over 50, ovarian cancer is very difficult to diagnose. For many women who have ovarian cancer, all they ever had was bloating. They go and take indigestion medicine. The doctors will say, okay, it's dyspepsia. But over 50 bloating symptom, don't ignore it. So those are the kind of symptoms. Night sweats, you can say, okay, it must be my menopause. But if you have persistent night sweats, again, anything lasting for more than 3 weeks, have it checked. Blood, it's a no-no. Cough out blood, check it out. And then symptoms lasting for more than 3 weeks, please have them checked.
Okay, so what about men's health?
Where do I start? whenever I talk about men's health, I always, something in me says, see who is talking. There was a time that I had swollen ankles, and my advice was go to your doctor. I said, what do they tell me? What will they tell me? So the first thing is that men generally do not go to the doctors. Women go to the doctors, women take children to the doctors, women have problems with their periods. There are various things that women have that takes them to the doctors. They have cervical screening, they have breast screening. So normally women go to the doctors. Men, the only thing that will take us to the doctors is PSA. And even that PSA, there is no agreement on who or where, how to go for it. So men generally do not seek health. The other thing is that many times men work morning. They say to be a man is MAN, morning, afternoon, night job. So men are always working. They don't have time. Going to the doctors is seen as a woman thing, is not a macho thing. Men are more likely to do things that are injurious to their health. They're more likely to be the ones that will work window cleaners, work on machinery. So men generally have problems, but they're the least likely to go. So for the women in the lives of men, I think you have a big responsibility. I'm sorry to say this, but I'm sorry to say this for men who are here. They say a man is handed over by one mother to another mother. I think that's true. Many women are very reluctant to mother their husbands, but that's the contract you have with your mother-in-law. You took over the mothering from her. So please, women, know what the symptoms that your man should know about, and then help him to get checked. At least here at age 40, everybody, man, woman, should have a health check. That's where most times things like hypertension, things like diabetes, high cholesterol, kidney problems, that's a fantastic opportunity for those early changes to be identified. So if your husband has not had a health check, your brother has not had a health check, age 40, age 45, age 50, it's an opportunity for health check. Nag him, drag him, make sure he goes for his health check. The next one is the problems of the prostate. Generally, it is said that I encourage every Black man to have a first prostate check at least by age 45. If it is normal, you have a baseline of what your PSA is. So if you go to your doctor may fob you off. Just tell your doctor, I'm a Black man, my GP doctor has said I should have my PSA checked. And then there's what is called, if you Google IPSS, IPSS is International Prostate Symptom Score. There are 7 questions that you'll be asked. When you answer those questions, you can get what your score is. I think anything 7 and below is mild. Then you have moderate to severe. If you have moderate to severe symptoms, please go and get checked at your doctors. So
Okay.
for men, those are the key things that I want to say: health check, as well as lower urinary tract symptoms.
Okay, so guys, everyone, please, you're free to raise your hands, or if you have any questions. I said there's a doctor in the house, so if you have any questions, please feel free to ask us questions. At least we can find him, so he's here and it's free, so we don't have to consult him. So I have a question here: shoulder pain and pain in the back of the head that has persisted.
Right. I mean, shoulder pain, most joint pains are fairly common, and as we grow older, we are more likely to have joint pains. I mean, if one has joint pain in the shoulder, there are 4 key movements of the shoulder joint. One is this, being able to do that. So if some people, when they do that, they can't get above this level. So that's one simple thing. Can you raise your arm across like that? The other one is to take the hand straight up front as if you're trying to do that. And then the other one is to scratch your back with your thumb. Those are the common 4 movements. If you can do those 4 movements, then your shoulder is fine. But if those movements are restricted, sometimes it's just to try and go over the restriction. But if you're in the UK, most GP surgeries now have what they call extended access physiotherapy. So your GP can ask you to see a physiotherapist. Or if you go to this website, csp.org, which is Charter Society of Physiotherapists, their website, you can find exercises, for shoulder problem. Neck problems, again, is what else is there, but the neck has 4 movements, really. Put your chin on your chest, look at the ceiling, put your chin on the shoulder, put your chin on the next shoulder. Those are the kind of common movements you can do with the neck. If there's any restriction, then you can seek help. Obviously, the spinal cord comes down. So if you move your neck and you feel a shooting pain going down your arm, or there are other things, then if you don't exercise, if taking pain relief is not working, then ask your GP surgery to book you in with the physiotherapist to have.
Okay, with the physiotherapist. Okay, and then there's another condition. And I can say it in Okrika, then you understand it. I'm sorry, guys. Excuse my French again. Torovimvi, turning of the eye.
Yes. And well, Torovimvi is a very non-specific symptom, but there are a few things.
Not like you lie down and then you see everywhere moving, going round and round.
Yes, there are a few things that can cause this. There's dizziness, there's vertigo. Dizziness is when you feel Torovimvi, while vertigo is when you feel the room is spinning, and there are slight differences. A few things that could cause that. One is blood pressure. Sometimes you find out that your blood pressure may be fine when you sit. Most of people who are on blood pressure tablet, but when you stand up, gravity makes the blood to rush down from your brain, and then you feel dizzy. So checking your blood pressure, if you have a machine, sitting and standing is one thing that will help you if it's blood pressure. The inner ear is responsible for balance. The inner ear communicates with the brain and it takes care of balance. Sometimes you can have a cold in the inner ear, the same way you have a cold in your nose. You can have a viral infection in the inner ear, and that can cause you to have Torovimvi, labyrinthitis, and that can make you feel unwell. It's usually viral, it's self-limiting. And then sometimes people can have low blood count. The red cells carry oxygen and food around the body. So if your blood count is low, you have anemia. So that if you have anemia, sometimes when you're moving, your body requires more oxygen, it doesn't happen. So that could be a sign of lack of blood. So that's another one. And the final one I'll mention is a common thing we see in general practice. It's called Bppv. Bppv is a big name for nothing. It's called benign paroxysmal positional vertigo. It's just, we have in the inner ear, we have crystals like tiny sand in the inner ear. They are in one part of the inner ear. Sometimes those crystals move out. When they move out, if you turn your head, you just feel vim. After a while, the crystals disappear and then you're back to normal. So those are 4 common things that I would say can cause Torovimvi.
Okay. Now there's something that you said I really want to ask because my time is running out. We're 7 minutes above time, but I will ask the question because it's health. Now there's sometimes, and we've had a lot of people that said, so he slept, he went to bed, he was okay, or she went to bed, she was okay. And then she got up to go to the bathroom to urinate, and then she dropped. And, Krika, they will say again, is they call it warning, like you saw an evil spirit that slapped the person, So what are the reasons why people just get up to go to the bathroom and then they die? What are the steps we can take to avoid those kind of things?
Okay, I mean, these things can happen in much older people. What happens is that, sadly, because of our lifestyle, as we grow older, cholesterol begins to be deposited in the walls of the blood vessel. So imagine if the blood vessel is this big, or the blood flows. If you begin to have cholesterol forming here, the blood vessels become narrow as we grow older. This narrowing of the blood vessels happens in hypertension. Diabetic patients die more from heart attacks and even the blood sugar itself. And it's caused by narrowing of the blood vessels. So imagine that the blood vessels that are taking blood to the brain have become narrow. And you're lying down. The blood is flowing well. As soon as you stand up, the blood rushes down. And once the blood rushes down, the brain can't control it. Like this light has gone off and the person drops. So the commonest reason this happens, one is narrowing of the blood vessels because of plaque formation over years. This is what causes people to drop when they stand. When it happens to the muscles of the heart requires oxygen, the vessels are narrow. When that doesn't happen, the person has a heart attack. Then there's what is called Micturition Syncope. When you go to pass urine, you know, if you sneeze, you can't wee when you're sneezing. So what happens is that sometimes when you put pressure to wee, that pressure to wee causes a narrowing of, it causes the nerves to just go narrow. And if that happens, the blood vessels just go narrow for just one split second. When they go narrow, blood doesn't flow to the brain, and then the person drops. So it's called Micturition Syncope, where there's just a nerve from trying to wee, it just triggers a nerve, and blood supply to the brain is reduced, and then the person drops. But all these things come back to diet, physical activity, stress reduction, lifestyle.
Good. So we can manage all of those things by healthy diet, exercise, stress reduction, and lifestyle.
Yeah, we reduce the likelihood of all the narrowing of the blood. Narrowing of the blood vessels is more or less the big problem in everything that is cardiovascular.
And that's because of the plaque, because of our diet and
over
lifestyle.
time, yes, the plaque formation over time.
Okay, so doctor, thank you so much. And guys, does anyone have any more questions? He's in the house, the doctor's in the house, and it's free consultation. Okay, Dr. Goma, I just want to say, let me just check if I have any questions on YouTube. Yeah. Yeah, And yeah, oh my gosh. Someone says here, a man is transferred from one mother to another mother. Okay. So guys, are you listening now? We are your mom. So when we nag you, it means we love you. Okay. Doctor, what is your take on the COVID vaccine, please?
Oh God, I was wishing this question would not come. There are 4 categories of people. There are those who, as soon as they had COVID vaccine, they just jumped and they were in the front of the queue. They've had their vaccines, they are sorted. And then there are those who are number 4. They are the people who are anti-vaccine. Even if you give them lottery tickets to say, take this lottery ticket money, go and take their vaccine, they say, I'd rather die than take the vaccine. Those ones, I'm not wasting my time on them. Only God can help them. So that's the extreme. Those that would jump right away. Before I say PIM, they've gone. And those that they would rather die of COVID than take the vaccine. Then you have those who are number 2 and number 3. Number 2, that the very wise ones. They say, okay, you make I go first. So those ones have waited. They have seen that in the UK, we have given, 30-something million. In the world, they've given like 900 million. It's okay, maybe go walk, maybe I go take my own. So that's number 2. Number 3, there are people who like their pastor. They don't want to disobey their pastor. So maybe with time, they can sneak in and take it. Or maybe they won't take. When they hear one person has blood, they say, America, why do you get America? I won't take. So they are not. Those are the 4 people. But then on a serious note, there are people who have the issue of confidence is there. People have done bad things to us as Black people. And when they suddenly show they love us, many people are skeptical, and honestly, I can't blame them. There's the issue of confidence. There's poor information. They didn't care about us. Next one is convenience. If the vaccine is being given next door to you, you can go and take it. Here, you have to go online to book. You have to go here. Some people just don't like stress. If the vaccine is in front of their house, they will go and take it. And then the final group is that there are those who feel that, like in Nigeria, when you look at the numbers in Brazil, in India, in Europe, they are massive. People are dying. I mean, now it's about 400,000 people a day in India who are being infected with COVID. In Nigeria now, the levels are very few. So people will say, yo, what is so? Because they feel it's not a problem. But if we have Brazilian type problems in Nigeria, they will queue. So it's about they feel now is no big deal. So look at that. So these are the 4 main things. But the point is that I've taken the vaccine, my family has taken it. So if I can't carry another man while on top of my head, it's up to you whether you take, you don't take, you don't concern me anymore.
Doctor, like they talk like Nigeria. So, Doctor, I have some questions that I have to take, even though my time is up, but then these are questions and even contributions. And someone says, thank you very much, Ibi. This session has been very educative. Thank you, Doctor. And another one says, thank you, Doctor, for lecturing us. God bless you, sir. And another one says, thank you. God bless you, Dr. Abiye. Lovely presentation. And someone else says, what an interesting and educative session. I have picked up some useful health promotion tips and a new lingo. Sorrow VV. Many thanks to you for your time, Dr. Goma. Okay. And Yibo says, oops. Hi, Soki says, hi, Uncle Yibo. Good to see you after many years. And someone is asking a question. She's saying, if a woman stops seeing her period for a year now, what should she do?
Okay, I'll answer that question, but Yibo, please bring the offering plate so that I can take the plate around and collect offering while I answer the question. Right. It depends on a few things. One, it depends on her age. If a woman is 40 and above, any woman who is over 40 and above can have an early menopause. So 40 and above, maybe she's at an early menopause. So that's the first thing. So, but 2, if she's in her 20s and her 30s, maybe she's pregnant. So that's the second thing, but not for over a year. So the first thing I would say is menopause. And then 2, it might be abnormalities in her hormones. So generally, if a woman has not seen a period for over 3 months and she's not on contraceptives, then I think it would be to see a doctor to do some checks. There are some simple blood tests, FSH blood tests will show if she's a premature menopause or something else is going on.
Okay, thank you. And Yibo says, thank you, Dr. D, for the presentation. I have taken my vaccine, Ojare. And Suki says, well done, Ibida, with lovely and cheerful hosting. Thank you very much. So guys, I want to say a big thank you for all of you who have taken the time to be part of this program. I'd like to thank Didi, Yibs, Cokes, Imuch, Mary, Okutwate. Okutwate, how are you? Soki, Victoria Ajayi, Victoria Gomba, Blessing, Uncle Datoro, Godson, my pastor, Monica, Jennifer, Amosi, hi, Amosi, my friend, and who else? And those on YouTube, I have Felicity, I have Obele, I have Laura. And guys, I want to say, oh yeah, okay, thank you. Someone says, good job, my sister. And thank you so much, everyone, for joining. And if you haven't subscribed to my YouTube channel, please subscribe to my YouTube channel. It's Ibinabo Enebi. And I want to say thank you very much. Someone says, thank you, doctor, for this educative session. God bless you real good. And guys, thank you, thank you, thank you. Thank you, doctor. I'll talk to you later. Yibo, what is